What kind of advice do you have for brain injury survivors and families, and also for healthcare treaters in dealing with this area of brain injury?
For professionals, a couple of things, because we're very big on this. A former counselor in the program introduced me this concept of I-thou. To always stay aware of the I-thou relationship. This is for professionals. Be aware of each other as having sort of the unity of being human beings, the mutuality. We that's a really core concept in our program, at least, and I think that's relevant to any kind of, professional relationship, therapeutic relationship. For everybody, the families, survivors, the professionals, keep educating yourself, staying on top of what the latest developments are. I'm very interested in some treatments of the future, how they're going to be incorporated in the medical world and also in the stuff that we do in the therapeutic world. Deep brain stimulation, transcranial magnetic stimulation, direct electrical stimulation, stem cells, virtual therapy, advances in neuroimaging. I think it's really important that we all sort of stay up with that and start really advocating constraint-induced therapy to get these things actually to happen on a more regular basis. For survivors, we have a lot of analogies that we use in our program. One is that you have to use a new measuring stick. You had a certain yardstick that you measured yourself by prior to the injury. Am I being successful? How am I doing? And really you have to throw that one away and come up with a new measuring stick, because it's a new you in some ways and a new brain. I really try to bolster people's confidence and sense of self. I tell them, you are now the expert. You're the educator for society. How are people going to understand about brain injury if not from you? It's not going to be from people like me. And so you're out there, you become the professional, you're the expert on your own injury. That's why I think it's so important to teach the brain anatomy classes and function classes. You're going to be the catalyst of changing people's perception of brain injury, changing society and how it relates to disability, how they view that. We talk to students about taking risks, try something new, go outside your comfort zone, persevere, appreciate the wonder of your brain. It's a fine line to walk, particularly in the brain anatomy and function class, because I talk about neurons being damaged, destroyed, changes in the brain. I always have to say to the students, I realize I am talking to people that have lived this, experienced this, and I don't want you to feel like I'm not sensitive to that.
And also, you don't want to take away hope. Yes, there's been damage, but there are things like neuroplasticity and treatments that can help them have an improved quality of life.
And we talk about that neuroplasticity and the wonder of their brain and what they've accomplished up to that point. To me, one of the joys of the job too is that, and we talk about this, is the brain is the last great frontier. It's more complex than anything probably in outer space or under the ocean. And will our brains ever be able to understand our own brains? There's a question. But really, if I had to pick one quote, I use quotes from some of the books. We do a lot of reading in the book club. In terms of resources for survivors, these are some of the books that we've read. Over My Head, can highly recommend, by Dr. Claudia Osborne. One of the best books out there. Most people are familiar with Jill Bolte Taylor because she was on Oprah. My Stroke of Insight talks about the right versus the left processing. For not only survivors, but especially for caregivers, family members, Where is the Mango Princess? Is written from the perspective of a wife of a TBI survivor. It's very funny. And right now we're doing I'll Carry the Fork, which is an older book. Great book, especially if you're an MTBI survivor, nobody's really validating you, and a very practical book of things to do. But the book I didn't bring with me, I didn't grab on my way out, Healing into Possibility, there's a great quote, and this is the one we talk about all the time. It's not about getting 75% of your old life back. It's about having 100% of your new life.
Absolutely. And using the resources that are available.
Right. And your strengths.